Kirsten, thank you for meeting with me today. I'm quite keen to see how you would evaluate a patient and how you would set up a patient on a Reve device. I don't know if you want to maybe just give us a bit of a background on yourself, and then let's take us through the process of setting up a patient on a Reve device.
Okay. I'm Kirsten. I work at Sleep Medicine with Dr. Tintinger, and we do sleep studies and CPAP titration studies for patients. Yes. So my part specifically is doing CPAP titration studies, taking the patient through the machine, following up every day to make sure the patient is comfortable, and yes, hopefully they have a wonderful experience like they usually do and sleep well. That's my part.
So at this stage, a patient would have already had initial assessment.
Yes.
And we're now setting them up for titration, which is the device that they're going to take home. How many nights would they then sleep on the device for the titration period?
Okay, typically a patient would use the machine for 2 nights. If there maybe was a problem or power outages or whatever the case may be, then we make the period a bit longer, but typically it's for 2 nights. So the patient can try the machine or try the different masks as well, so typically for 2 nights. Yes.
And while they've got the machine, would you change the settings while it's at their homes, and how would you go about doing that? How would you monitor them remotely?
Okay, so we have standard titration settings for the machines. If there is maybe a discomfort from the patient's side, or they feel like the mouth is too dry or anything, that we can make remote set adjustments from our side, which is wonderful about the machine. So yes, that's the settings are set up standardly, and if adjustments need to be made, then we can do it.
Okay, great. Okay, so show us what you do normally, and then I'm your next patient, so let's see how this goes.
Okay, wonderful. So in the back, we typically have the full face mask with 2 types of sizes, large and medium for men, and then the nasal mask and the 2 sizes. Okay. Then we have the machine. Attached is the humidifier, power cable, and the pipe.
Perfect.
Okay, and then the bag as well. So I usually plug the machine in. Okay, so there's 2 holes there in the back.
Okay. And this you would show a patient how to do this, so they can go and do this at home.
Yes. So I plug it in the second hole. Okay. Just need to plug it in.
Perfect.
Okay. Do you struggle with a dry mouth in the mornings?
Definitely. I snore quite a bit, and if you look at my double chin, that's what got me here.
So what's great about the machines is they come with a humidifier. The humidifier prevents the throat from drying out, will help open up sinuses. And especially now in the winter, since the humidifier warms up the water, you breathe in a bit of warmer air, which makes it also much more comfortable.
And how would I go about filling this humidifier?
Yeah, so to fill the humidifier, you hold in this button. And then it pulls out on the side. Okay. You then just open it up and add water till the max line.
Okay, perfect.
The water should ideally be as clean as possible. Distilled water, or you can boil water and let it cool down and add it. Or if you have bottled water available at home, that's also convenient.
So I would fill this before going to bed?
Fill it before going to bed. You just push it back in.
Perfect. Great.
The water usually lasts a couple of nights. It depends on how warm or cold your room is. So if it does run empty, then you can just add water. I just want to please point out that if there's any traveling with the machine, to remove the water, otherwise it can cause damage.
Okay.
Right. Then the machine itself is very easy. We already set it up according to the titration standards, and minimum setting of a minimum pressure of 4 and a maximum pressure of 20. The reason we're doing this study is to determine what pressure is needed for your therapy. So over the next 2 nights, the machine this is automatic machine, so it's going to give the pressure that is needed for your therapy to be effective. So we want to determine what is that pressure that is needed for your therapy.
And you would do that through the remote monitoring. You will get a report afterwards that shows you that.
So tomorrow I'll be able to pull a report directly from the machine. I'll phone you and give you feedback on the results that we found.
Okay. Great.
So the machine itself is very easy. When everything is connected and you're ready to sleep, you just switch the machine on. Okay, then it will start blowing.
Okay. Easy enough.
To switch it off, you just press the button again.
Okay.
Okay, as easy as that, very user-friendly. If you do wake up during the night to go to the bathroom or to drink water, I suggest you rather switch the machine off. And when you get back into bed, you just switch the machine back on.
Okay. Will it automatically detect if I take off the mask?
Yes, so it will automatically detect. The machine will show a pop-up that says mask off, then it will just blow nice and low. And when you put it back on, then the machine will start blowing again.
Okay.
Okay.
I've heard other patients complain that the air blows past their face and they hear all that air blowing past their face.
Yes.
What would that indicate? Would that be a leak, or is that a mask fit, or what should I look out for?
Yes, so since it's an automatic machine, the machine measures your breathing patterns. As soon as the machine realizes that there's a change, then it will increase the pressure.
Okay.
That increase in pressure will typically happen when there's apnea. Sometimes the patient can wake up from that higher pressure, they feel uncomfortable, and then the pressure increases even more. Or otherwise, there's maybe mask leakage.
Okay.
If the mask leaks, and the machine tries to compensate for the mask leakage and pushes up the pressure even more. Therefore, there's a ramp function.
Okay.
What the ramp function is the machine, we set up our machines that it starts at a low pressure for 20 minutes. After 20 minutes, the machine will adjust as needed.
So that's giving me time to get to fall asleep.
To get comfortable,
okay.
yes, to fall asleep comfortably. So if there is any discomfort during the night, then this ramp button can just be pressed.
Okay.
Okay. If you hold in that ramp button, then the machine will go back to that lower pressure.
And then
and build up again as
okay.
it's needed. Alternatively, the machine can be switched off. Make sure the mask sits properly, then you can switch it back on so it can again build up slowly.
Okay, great.
Okay,
great.
Yes. So that is the machine settings.
Yeah.
What's also very convenient is that the humidity can be adjusted according to each patient's need. So for changes to humidity, you can just hold in that button.
It will drop.
The droplets, yes, on the screen. You can increase the humidity if you feel like your mouth is too dry.
Okay.
Or you can decrease the humidity if you feel like there's condensation. So what sometimes can happen is that they can feel like there's water droplets in the mask. So ideally then you would either decrease the humidity just so it feels more comfortable. Especially now in the winter, it's most ideal to put the machine a bit lower than your bed, just that if there is water building up, then it can flow back into the machine rather than building up in the pipe.
Okay, that makes sense, yeah.
Yes. And that's how easy the machine is.
So there's no manual settings that I have to set up as a patient.
No manual
settings. Get a preset up from yourself, switch it on, put water in the humidifier,
yes,
put the mask, fall asleep.
Exactly, and that's why it's so user-friendly for us. The patient is already so overwhelmed with having to sleep with a machine, so having simple buttons to press and simple steps to do just makes it much more comfortable.
Okay, great. Okay. Thank you very much.
It's a pleasure.
Great. So I think in the event that a patient would then get their own device and they would like to change settings on the device to get that ultimate comfort level that they're looking for, what settings can you change on the device?
Okay. So typically just settings that can be adjusted for the patient's comfort. On the machine itself, there's a setting comfort control.
Okay.
It refers to the patient's breathing out.
Okay.
Okay. Sometimes I do get patients that feel like they struggle to breathe out against the pressure. Then the comfort control settings can be adjusted to what makes the patient
Is this
feel
a common
more
feature on all devices, or is this more specific to Reve itself?
It is a specific feature to the Reve itself, the comfort control. So it just makes it more convenient for the patient. I like playing around with the settings so that the patient has the ultimate comfort of the machine. So to get to that setting, you just hold in the ramp button.
Okay.
Then the settings icon will flicker. So you just go in there.
So normally that will be locked out, that the patient can't unnecessarily make adjustments,
Yes.
But should they need to, then they can.
Yes, exactly. You go into that icon. Okay. And then you can just increase the comfort control and decrease the comfort control.
Great.
Yeah. So the higher the comfort control, what the patient's experience is, if the comfort control is set to its highest, then the machine will let out the maximum amount of pressure. If the comfort control is switched off, then the machine doesn't control your breathing out, it's just your own breathing.
Okay.
Okay.
Outside of that, anything else that I need to be aware of to change?
Humidity, time can be changed. The time can be changed. This moon icon can be pressed so that the screen going off, so that the light doesn't bother you.
Okay.
But ultimately, we don't want patients to play around with their pressures.
Yeah.
Just that's the reason why we're doing this, is so the
Yes.
doctor can determine the pressure for the patient. But the comfort for the breathing and how the pressure feels can be controlled by the patient.
Okay, great. Yeah, I think that's pretty basic, and it's easy to use.
Yes, exactly.
There's nothing too difficult to understand
Yes.
when going through the process.
Yes, exactly.
So maybe to change it up a bit, I think you've put many patients onto a Reve device.
Yes.
What do you like about the device, and why would you say this is a good option as a titration device versus some of the other devices you might have used in the past?
I really like the Reve device. The reason is the feedback that we mostly get is people saying that the device is very quiet.
Okay.
And I'm happy that we can do it for patients, because they have this idea that CPAP machines are very noisy and loud, and it prevents them from getting a machine. But showing them that the machine is quiet already makes it a better experience for them. I really like enjoying the machine, since we can make remote adjustments from our side for the patient's comfort. That's also very convenient. The machine is very user-friendly, just switching it on, switching it off. It's easy to get to the humidifier. You can see when the water runs empty. So it's just a very convenient machine, and the patients find it very easy to use. We have patients from 90 years old that are able to use the machine. So it just makes it very easy for them.
Okay, great. Yes. And from a quality perspective, do you ever get any issues with the devices, or are they fairly hardy in the South African environment?
So I must say, we don't really get problems with the device. Since we can pull the reports from our side, which it makes it very convenient. We don't really struggle to pull reports, since the patient is already uploaded on our system, and that makes it convenient. The only problem that we do have, I must say, is the patients sometimes break the humidifier. We've had a couple of humidifiers being broken. They try to force it even further than
strong South African mate.
Yeah.
But I think that's a key thing then to show,
yes,
as you're setting it up for them to look out
exactly,
for.
Exactly, it's to look out for. But otherwise, we don't have any problems. And what's also great is sometimes patients forget to remove the water from the machine. And since this machine prevents the water from flowing into the machine, it has like a backflow. That also makes it very convenient, so we don't get damage to our machine. So that's also really nice.
Great.
Yes.
Thank you.
It's a big pleasure.
Thank you for your time. I really appreciate it.
Yes.
And I think you're doing a great job. The feedback we get from patients coming back to us, or on our online sites, really good positive feedback we get, and the clinical site provider is great.
Thank you so much.
Thanks.